This video is about different phases of topical steroid withdrawal. This patient of mine had unwittingly gone through one round of topical steroid withdrawal many years ago. She hadn't done much research then and just stopped using steroids. The consequence was that she went through a full-blown flare, but she wasn't really prepared for it. It was really bad and she caved in. This time round, she tried again with assistance from our clinic. For the first 4 weeks, it was terrible. It's always terrible to go through topical steroid withdrawal.
It's something which we all have to go through to finally get to a layer of skin where it totally cleans off and now it's just flaking only.
She will talk a little about the hot and wet phase, which is the acute phase.
It's so damp, you don't know whether you're sweating or you're weeping, so it's rather frustrating and very uncomfortable, weepy, and the slightest scratch I did, it will ooze, and then the stickiness is so uncomfortable, especially the areas where you sit on your thigh. The worst was my ears, which I never had eczema. My ears will weep at night when I sleep on my sides. So uncomfortable. Every morning I just don't feel like waking up because it's sticking to my ears and my hair was stuck to the ears, and then my hair will just fall off because it's stuck there. From the weeping, it's so uncomfortable, I can't sleep at night. And you feel hot, but yet you feel cold. You feel cold on the outside, but very hot inside. So you don't know what you should do, whether you should be under the aircon or under the fan, but you can't blow the skin directly with the fan, so it's very hard to manage.
Anyone who has gone through TSW will understand the flaking part, and we describe it here so in case you have not gone through TSW, at least you get a sense of what it is.
The skin is like scabbing and flaking, and then every day is just a routine. I have to sweep the floor, clean up the mess on the bed. The skin was just peeling like a tree trunk, like, you know, the scabs. You don't know whether you should peel it off or not because it's so irritating.
But today, a month later, you can look at her skin and it is no longer hot and wet. It's no longer oozing and flaking in a terrible way. She is not experiencing cold shivers all the time. She is past the hot and wet phase, which is what Haja et al. Describes as erythroedematous presentation. Instead, she is in a dry phase. The dry phase is uncomfortable for other reasons, but at least the acute flare, which is the most difficult, is over. Listen on as she presents her present situation.
Took me a month to clear off the scabbing because my arm was the worst. My arm was always the most reddest and the most angry looking skin. So when I took Dr. Mark's herbs, it kind of like cleared all the scabs. Then there was one point where I had infection on the 3rd week of my treatment with Dr. Mark. I had staph infection on my hands. I was so shocked to see yellow dots on the first layer of my skin. I don't know, should I poke it to release the yellow part or should I leave it? He added some herbs to help with the infection. Then it kind of cleared the next day. It looks flattened and then it will like kind of dry off and drop off by itself. So it was frightening at first, but actually Dr. Mark assured me that it's common. I listened to him and the next morning I saw it dried off and cleared, so it was very reassuring for me.
So I want to say something about the staph infection being common. I would differentiate between 2 types of presentations. On one hand, you have the erythroedematous presentation, and you're mostly red, very hot, a thin layer of damp that keeps oozing all over, and it's usually dispersed and widespread. In her case, this was the presentation. On the other hand, you have more of a discoid presentation where you have holes that are oozing, and oftentimes there is the characteristic yellow ooze, which is much more indicative of bacterial infection. In both cases, we use Chinese herbs that have antimicrobial properties to help to improve the situation. Sometimes we get very good results. In her case, the results are more than good because within 1 day, she saw a change. And we normally keep the herbs there within the formulation because we want to make sure that this doesn't happen again. We also have cases where we do this and we need to keep checking in to see how the patient is. Some patients, they may see the situation resolve maybe within a week or two, and that is more normal than in her case. And then the patient starts recovering more normally. We also have a situation where the staph infection gets worse very fast. And in those cases, it is very prudent to consider using targeted antibiotics. And this means going for a swab test to make sure you get the correct antibiotic for your infection. Because in many of these recurrent cases, broad-based antibiotics like amoxicillin, for example, may not work because likely there is already some form of antibiotic resistance. In other cases, we find that patients have a hard time with this recurrence of staph infection, despite trying a mix of antibiotics and then of course going off it and then going on herbal formulations that we give that are, you would say, not as strong as the antibiotics, but also less likely to give you that kind of an antibiotic resistance that you don't want to have. But also using multiple herbs in a formulation reduces the chance of the bacteria mounting a resistance against the antibiotic treatment. In these cases, it is really not so easy.
Dr. Mark will actually monitor my condition, so now my infection is not that bad. So he will lower the dose of the antibacterial herbs and then to condition my skin to be less drier, which is a good thing because looking too dry is also very disturbing.
Ultimately, when we're using Chinese medicine, we are trying to create a formulation that best fits your presentation. You could have skin presentations that we look at as indications of how we should change the formula. Your condition could also manifest in your tongue and in your pulse, and also the symptoms that you describe. So in her case, we're slowly changing the formula from bringing down the heat or reducing the redness or taking away the temperature dysregulation. Now it's more about reducing the low-level inflammation, helping with moisturizing the skin, and also helping with skin regeneration. As you can see, her skin is now mostly dry. I would assess it as quite good, and we hope that within a month, she will have less of these dry symptoms and report as being better. Hope this was helpful, and thank you for listening.